Hi, this is Dr. Farley. I just want to go over with you some of the concepts about our healthcare philosophy and what health actually is. I hear people all the time, sometimes they'll come in and they'll say to me, hey, is this a cure for my thyroid? I want a cure for my Parkinson's. Whatever the disease name is, they believe that there's some magic pill in the sky. It's always a drug because the pharmaceutical company is making everyone think that they're going to cure these diseases over time, which is really a ridiculous idea. Cure means to restore function, and no drugs restore function. They only manage symptoms. So that's the true snake oil that's out there. If the body is given what it needs and you remove what it doesn't need, it has the opportunity to possibly function at a higher level, and the only thing that's ever going to cure anything is the body. So I respect that, and we call that the innate intelligence of the body. We respect that we're trying to work with the system, we're trying to be non-invasive, and we're just trying to provide what it needs and remove what it doesn't need and give it an opportunity to work. And then depending upon the factor of time and also how much damage there is there, the system may work at a much higher level and never get any worse. It may completely reverse itself, or if it's going to fall off over time, it's at a much slower rate than not. So back to the idea of health. When you look at the three healthcare philosophies, there's the allopathic drug model, which says everything is genetic, which has been shown to be scientifically untrue. We give you drugs and we treat disease names. That's the model. Very simple. The alternative integrative model says normally, again, you have a genetic problem. We're still treating disease names, usually using drugs. But hey, we'll try some of this alternative stuff, some essential oils, some acupuncture, chiropractic, homeopathy, massage, but again, you're still managing symptoms, and you're not necessarily going after the root functional cause. It usually has less side effects because they're safer, but again, it's not a deep enough approach. Then there's what we do, the Farley neurobiomedicine model, where we're looking at the epigenetic science of dis-ease and longevity, the lack of normal function. Now the question is, how do you know you have it? You've got to measure. So all of the testing that we do in here, all of the lab work that we do, the expanded panel and the specialty panels, and any of the specialty lab work, is to identify functional abnormalities. What's not functioning well? Which gears are off? Then from there, we establish the best plan to try to restore function. So these are individualized plans, all aimed at function. Another really important chart in here is this one here that you've probably seen along the way, and it's the healthcare continuum, and it basically shows you that optimal health is here. Optimal health is physically strong, mentally clear, emotionally sound, and socially balanced. That's what health is. It's function. It is not how you feel only. By the time you feel bad, you're down over here. You're one step above death. Honestly, you're one step above death. You have to have 85% damage to your cells to get symptoms. Parkinson's patients, Alzheimer's patients, all of these patients, cancer patients, 85% damage, and then you get the symptom. So the idea to talk about when did you get the symptom as if there's some reality to that is a total, again, snake oil. It's a snake oil thought process. It didn't happen 2 years ago, 3 years ago, 5 years ago. And your objective should not be only to reduce the symptom. Your objective should be to try to restore your health to whatever level you can. And you need to find a doctor that focuses and can measure functional tests. If your functional tests are moving in the right direction, that's a sign that you're really achieving higher levels of health. Of course, I want everyone to be saying, hey, doc, I feel better. And most of our patients, 91%, feel better in 2 to 4 weeks. The next question is, though, are they actually getting healthier? That's doing the testing, the retesting, the blood work, the re-blood work, all of that kind of stuff to track someone over time. And if all of that is in line and you're saying, hey, doc, I'm feeling better, that's the best from my perspective, because I want you to not just feel better, but most importantly, be getting healthier. And we can track you over time and make sure that your health is moving in the right direction. If you're a chronic case patient and you want to know, hey doc, what's going on with me? Well, I just periodically jump in and do my retesting again, run some new blood work on you again, and we can see where you were and where you are. And we can modify and make changes based on what's changing with the system. So health, again, is how you function, not how you feel. And by the time you feel bad, we're almost dead. One more thing you want to know. Most patients, most deaths occur between 50 and 65 years old. 85% of people are going to die in that time frame. The reason for that time frame, I believe, is because that's about how long you can go when you are not addressing function and you are managing symptoms. So bodies can go a long time with giving it the wrong stuff, but not that long. So if you make it past 65, it means something that you're doing is letting you function usually at a higher level. And one more thing you want to know too. Any disease that you get is the body's attempt to deal with the improper function. So if you didn't get the cancer, you'd be dead. If you didn't get the autoimmune problem, you'd be dead. It's the system trying to manage all of the improper function from the different stressors that you keep hitting it with. Keep in mind also, you're getting and what you've gotten is what you've done to yourself wrong. Most diseases, less than 5% is truly genetic. So no one dropped bad genes on you. It's that what you're doing is wrong and you know it, or what you're doing doesn't work and you may not know it. And that's what we're here to figure out for you. So I hope this was important. Again, health is how you function, not how you feel. Of course, we want everyone to feel better soon, but we also want to make sure that your function goes up and your health is moving in the right direction. Thank you and have a great day. Any questions, call us.